COVID-19 cases in the state have been on the rise over the past week, with the state reporting 50 positive cases today. Positivity rate too has seen a massive spike to over 6.39%, as the Directorate of Health Services has urged people to wear masks and get their vaccine doses. Here's more on the developing situation.
Cases which had nearly flatlined after the third wave have once again seen a rise, with over 50 cases being reported today alone. Cases in the state rose by 174 in the span of just 1 week, after reporting only a mere 13 between the 15th and 11th and 17th of April. While no deaths have been occurring, the rise in cases is alarming as schools and monsoons are set to begin.
आता तुम्ही पळयलें आसतलें की फाटल्या दिसांनी केजी मातश्यो वाडत आसात. काल 47 केसेस आशिल्ली, आज 50 आसात. रायज जरी कमी आसा, देर इज डेफिनेटली अ रायज. आनी whether it will be a fourth wave and all, it is too early to predict, but we can only say there is a rise of cases.
Cases, 50 cases are positive cases, and this is out of 782 samples tested with a positivity rate of 6.39. Now, if we see last 3 days, our positivity rate is going above 5%. And if we check our weekly cases, we dipped to almost around 13 cases only for entire week. This was on week 15th of this year, and now if we see in this current week, for last 5 days we have got 176 cases. So if we see this, weekly rise is definitely there, although it is a small rise, but then it is some initial rise which is seen. Whether this will convert into a major wave or not, we really don't know at this point of time.
However, the DHS informed that Omicron is still the persisting variant and poses only mild threat to patients. Cases, however, could see a further rise, although with a lower hospitalization rate. Listen.
आता आम्ही 50 पर्यंत पावले. दिस इज अ सिग्निफिकंट नंबर. म्हाका जर एज अ इम्युनायझेशन ऑफिसर म्हणून जर तुम्ही विचारशात, दिस इज अ सिग्निफिकंट नंबर. कांयच नाशिल्लें थंय 50 जावप. इनिशियली फ्रॉम 0 to 10 जावप डिफिकल्ट. 10 चे 20 जावप कंपॅरेटिव्हली इझी. 20 चे 50 जावप इज कंपॅरेटिव्हली मच इझी, आणि 50 चे 500 जावप इज मच मच इझियर. So let us not wait till it becomes 500 and 5,000. Let us take the steps right today.
Keeping in view the rising cases, the DHS has once again urged all those eligible to take their booster doses, especially for healthcare, frontline workers and those above 60. While no new guidelines have been issued, the DHS has urged the public to observe social responsibility and take proactive measures in keeping their own health safe.
Vaccination, whoever is not taken, they have to come forward and take it as immediately as possible. Even variant data, madam has already said, whatever 68 samples we had tested at North Goa district hospitals, all have shown as Omicron BA2, which is not new variant. And if we even see our admission rate on a daily basis, even admission rate is shown in our media bulletin, it is almost close to zero. We had one admission few days back in GMC, and last few days we don't have any admissions. If we see our death rate is again zero right now. Definitely there is a rise, so what we will right now tell or ask public to do is take precautions for their own good and take vaccination.
Don't wait for the guidelines to come. As madam is saying, जीव जर आपल्याला वाढवपा जाय जाल्यार गायडलायन येवना म्हणून हांव गेल्लो आनी म्हाका कोविड जालो. कॅन वी से दॅट? सो इट इज बेस्ट that don't wait for the guidelines. Use your logic.
However, with cases on the rise, many have begun to worry over students who set to enter schools starting on 7th June. However, upon being asked whether opening of schools would be postponed due to the virus, the DHS said since people continue to work, go on picnics and vacations, it wouldn't make any sense to only close schools. Continuing to quote Modi, "Jaan bhi, jahan bhi."
You tell me, supposing we say आता cases वाढतात, have we stopped going to market? Have we stopped going to work? Have we stopped going for picnics? Have we stopped going for vacations? We are doing everything. It only comes to school, then we raise a question. My request is, सगळ्या भुरग्यांनी जर वॅक्सिनेशन जर घेतलें, घरा कडेन पेरेंट्सांनी जर घेतलेलें आसात, there is a comfortable, safe zone around them. We have to see, as you must be remembering, आमच्या प्रायम मिनिस्टरान म्हटलें, जान भी और जहां भी.
Monkeypox, meanwhile, has put the state on a vigilant eye, as all doctors in the state have been briefed over symptoms and procedures related to the disease. So far, only one sample suspected of monkeypox has been sent for testing to the Apex lab in Pune.
Monkeypox, we have received advisory and detailed guidelines from Government of India, and as of today we don't have any cases in India and neither in Goa. Advisory is sent to all doctors in the state, whether it is in government setup or whether it is in private setup, so that they are aware. They can, anytime they see some cases with fever, with rash, and especially when if such cases have a history of travel from all these countries where monkeypox cases are found, then they should keep some suspiciousness in mind, and they should send samples through Directorate of Health Services to NIB Pune, and we should send test such samples. So that advisory is gone to all doctors in the state. And other things are, there is a possibility of even home isolation in the guidelines. Even if tomorrow we get some suspect or a confirmed case, there is a possibility of a home isolation like what we do in even COVID-19. And there is, if at all patient needs any management or any critical management, patient will be shifted to our hospital isolation, and then the patient will be managed.
So far, any suspected cases?
In fact, we had sent one sample which was more of a chicken pox, just to check our sending of a sample to NIB Pune. It came as a negative, but then strong suspect we have not got any right now.
Shamchari for Goa 365 from Panjim.